Hello. Just waiting for some people to hop on, and we'll go ahead and get started. Okay, so we'll go ahead and get started, and then this can be reviewed at a later time on our timeline. So just a couple things to get started. Our cases remain the same as yesterday at this point in the day. Of course, we could get something reported between now and 4 o'clock when we usually update our cases, but we're still at 22. So that's a good thing. We've had more than 225 people tested that we know of. So that's also a good thing as well, because people are getting tested. So again, just to reiterate, we do not get all of the people who are pending or people who are negative. We do not always get those results. That's not mandated to be reportable. Only positives are mandated by law to be reported to the health center. So that's why that number is a that we know of number. But that's where we're at today with the 22. I wanted to explain a little bit about the contact exposure piece in our data that talks about basically the source of infection. So that's where it says travel or contact related case counts. So that's really just a way for us to break down where those cases might have come from. So you have one that is travel related. So that means that person traveled to somewhere where there's ongoing community transmission, in this case, St. Louis. And then you have people who are contacts. So the contact is a contact to a confirmed case. So that means 13 of our 22 cases were contacts to other cases that are laboratory confirmed. And then we have 8 that are no known contacts. That means they haven't traveled anywhere that we know of that has ongoing transmission. They do not know anyone who's been sick. They don't have anyone that they're a contact to that's a confirmed case. So it makes it tough to know where their source of infection is. So that's where you get the no known contact. Recovery. So we have 7 right now that are recovered. I believe we're going to add one to that list at the end of the day. So the definition that we are using for recovering or to be recovered at this time, we've discussed before, but that's 7 days past onset of symptoms and 3 days of being recovered without the use of fever reducing medications. I expect that case definition to change. That's really not a definition that the state is using right now. That's not mandatory to be reported as far as recovered cases, but we know that that's important, and I think it's important for the public to know that people are getting better because in all of the tough news and the tough things that we have to deal with, I think it's important for all of us to understand that 80%, 81% of people are going to have mild illness. The majority of people are going to recover. Obviously, mortality rates are changing depending on what numbers you're looking at. But it's important to know that people are recovering. But I do expect that case definition is going to change at some point because the state is saying that they are likely going to start having to report the recovered cases. And so it may not be the same case definition in the future as it is right now. Somebody sent in a question about having no fever. So is it possible to have no fever and also be positive for COVID-19? So that's another one of those kind of tough things about COVID-19, and that's where you're seeing, social distancing being really important, and wearing a mask when you're in public settings, or a cloth covering when you're in public settings. Why that's really important, because you can transmit this when you are asymptomatic. By CDC standards, whenever we do a case investigation, we go 48 hours before they started showing symptoms to do our contact tracing and our investigation. So that's really an important part. And certainly some of our cases have either reported no fever or have reported a low-grade fever. So that's important to know as well, because again, this is something like a mild illness that you might not necessarily think, oh, I might have the new coronavirus. So that's why these policies for social distancing and the recommendations for cloth coverings in public settings are really important, because you might be sick right now and not even know it, or you might be, a couple days out from onset and could be already infected. I realize that's kind of unsettling, but that is kind of the fact of the matter. And so it is possible to have this virus and not have a fever. I will say in our cases that have been really sick, those have had a high fever. So keep that in mind too. I want to talk a little bit about media. I've gotten some calls, people that are concerned that the only time that we update the public is via Facebook or our website. I do media calls with local media on Monday, Wednesdays, and Fridays. So that includes print media and also radio media. So we're actually touching base with them multiple times out of the week to give the same updates and information to the public in other ways, because we understand that not everybody has Facebook or the internet. So also got a report that people are microwaving masks, whether that's homemade masks or surgical masks if you have one. That is not recommended and might start a fire, so please do not do that. Your cloth masks, you can wash them and launder them just like you would your clothes. I would suggest hot water and then the high heat setting for the dryer, because that's going to kill anything that's on those masks. It'll pretty much kill them. So please do not put those in the microwave, because it could be very dangerous for you and your family and might start a fire. The last thing I want to talk about before I kind of get to some of the comments is the stay-at-home order. And a couple of things to know is, obviously we're at 22. We've been at 22 for a couple of days, which is good news. Cases in Missouri are continuing to increase, but are increasing in such a way that right now the healthcare system and locally the healthcare system is doing well. We don't want to see that big surge. We've talked about that in the past, so I won't go over that again. But right now, those social distancing policies are working well overall. We're always going to have folks, some people who don't abide by those, but I think for the majority of us, I think we're all making changes in our lives to support this and prevent or slow the spread of the disease. So that being said, the statewide order runs through next Friday as of now. Yes, the 24th. I'm looking at my calendar over here. So our order here locally, which is very similar to the statewide order, is until further notice. I think that that order will probably be rolled back as the state rolls theirs back, and we haven't heard a plan yet for how the state plans to do that, if that's going to be kind of a soft rollback, what that's going to look like. We were told that possibly we might be hearing some more about that in the upcoming press conferences by the governor, but at this time we don't have any additional information. I can't imagine that it will just be, okay, it's all over, everybody go back to doing everything as usual. But I think that remains to be seen. But right now, we're doing well. Our healthcare system is doing well, and they have enough capacity to do what they need, and that's good news. That's what we want. We know that there are some businesses out there who may not be doing what they're supposed to be doing, and we are taking appropriate action as given to us in the orders. And so we are working on that. Again, I want to just encourage everyone, we all have to do our part to social distance, to wash our hands and stay home as much as possible. And again, I know that that's not always easy, but it really is up to all of us to do the right thing. But again, there are businesses that, we're working with, and we follow up on complaints, concerns, those types of things, and we're working on that. So, okay, I'm going to kind of scroll back and take a look at some of the comments and the questions. Yeah, what parameters will be used to determine when the county opens back up again? So again, the statewide order is still in place. So even if we decided to take back the county order, which again, those two are very strikingly similar. Really the main difference between those orders is that we have our innovation clause under Article 4 says that those businesses that are not exempt would need to request approval from the health department to operate. The state's order says non-essential businesses can operate if they can maintain social distancing, gathering requirements, and hygienic practices. So they're very similar because those are the same criteria that we would use to allow someone to be innovative to continue running a non-essential or non-exempt business. So I think it's going to be a lot of looking at what transmission looks like over the next few weeks at the state level, and seeing really where we're at and how the capacity is for the healthcare system. But that'll be something that we're working with the state and listening to the state direction for those types of things. I see some kind of specific questions to maybe a specific patient, someone that's sick that might need testing. To be tested, you have to be tested by a healthcare provider, so it has to be ordered. I would follow up with the entity, Cynthia Watson, follow up with the entity and find out, what the situation is around that. It sounds like maybe I need some more information and discuss that further, but healthcare providers, healthcare entities are who does the testing for COVID-19. Sharon Wallace, can a person be recovered but remain with a cough for a while? Not technically by CDC standards right now. When we release folks from isolation, that's that 7-day and then the 3-day rule that I talked about earlier. Sharon used to be the director of the health department, so that's why I was smiling about that. But so not necessarily, because they have to be symptom free for 3 days before they are considered ready to be out of isolation, and that's what we're using as that recovery definition for us right now. I think that's going to change. I was on a call yesterday with the state, and it sounds like at some point they will also be tracking recoveries, but it won't be based on that. It will be based on, likely, this is the proposed method, would be that any person who tests positive for COVID-19, and if they do not receive a death certificate for that person 30 days after that diagnosis, they would consider them recovered. Again, this is not solid. That is not something that's happening. That is just the thought that maybe that might be how they define recovered in the future. Of the cases in Farmington, how many of those are recovered? I don't know right this minute. We have 8 that are going to be recovered. We have to update our cases at the end of the day. So we have 8 out of 22 cases that have been recovered. Of course, one of those is resulted in death. 8 people have recovered. I don't know which of those fall in what zip code at this point. I have been asked this on this post for 3 weeks, and how come use or turning down everyone to be tested? That's why we only have 2 cases in Farmington not testing. I hope I'm understanding this right, but it looks like in Farmington there's 11 cases. But again, I just want to reiterate, doctors use their clinical judgment to test. So the health department doesn't test. We don't approve testing for the state public health lab. The state approves those. They have clinical criteria that they use to test folks. And most of our providers in the area are testing for this. So that's really important to know. But, they use symptoms, sometimes exposure. But obviously we have 8 cases that have no known exposure. So they're really using a lot of that symptomology to decide whether or not somebody needs to be tested. But that's something that the providers are doing those clinical assessments. Just looking at my time here. Close friend was tested, and it was not a bad experience. Only one side, no worse than the flu swab. Is that normal? Yeah. So it's strikingly similar to the flu swab. It's kind of uncomfortable, but it's not at this time. It's not like they're drawing blood or something like that. I mean, it is pretty simple. Again, flu swabs can be kind of uncomfortable, but it's not a big to do to be for the actual test. I know someone who was sent home from Walmart with a fever. They were refused a test. Why? I don't know. Again, that's something that the provider does. So I would say there are tests. My understanding is that our providers are doing good on testing capacity as far as the number of tests. But that's something that, again, a clinical judgment on a provider if they feel that this person warrants a test. That's something that the providers have to assess. Yeah, I drove around on Easter and seen a lot of people visiting, a lot of cars that parked at homes that normally isn't there. I think that will also be a telling thing, and I will say that it's not abnormal for after a holiday for us to see an uptick in reportable diseases. That happens a lot during flu season, after the Christmas holiday. It happens around Easter holiday, typically more so with salmonella because of baby chicks, but certainly in the summer months we do tend to see more salmonella reported when you have barbecues and things like that. So I say that because it will be telling to see what we see following the Easter holiday. Of course, the incubation period is 2 weeks. So, I think we could see an uptick related to the holiday and people gathering. Even though they weren't supposed to, people were told to stay home as much as possible. Again, we know that you're always going to have people who decide not to follow that guidance. And so I think it'll be interesting to see that. Yeah, I see more issues of testing. So what I can say is that, again, we have sent guidance to the healthcare providers. We've got a lot of people who are negative. So we've got a handful of people who are pending. I'll have to look that exact number up. But a lot of negatives have come through in the last couple days, which is good. But I can't really speak to exactly what the reason is for the refusal to test, but I will do some following up on that with some of our contacts in the healthcare provider's office. But they do have the clinical criteria for testing, so I really can't speak to their clinical judgment because, again, that's really their call. All right, I'm going to try to find one more question. What do you think about the peak in Missouri? I've heard different ideas or different thoughts of what that might look like or when that's going to happen. When I hear that, it's usually changed every time I hear it. So the most recent thing that I heard came out of a group from St. Louis that was thinking it would be maybe in May. And again, it would be one of those peaks that are not such a surge. It's a longer flattening the curve. So that's a good thing. But I think this as far as the state, what their stance is on the projection of peaks is that there's not enough good evidence to say for sure when a peak is going to be. So it's more of a hypothesis. An educated guess, that type of thing. So I can't say for sure when I think it's going to peak because I don't think that would be providing accurate information. Do you feel people are getting tested too late and we are getting false negatives? I would say no, because people shouldn't be tested unless they have symptoms. And we also know that people can be positive for these tests because these are not antibody tests. They can actually be positive even after they are feeling better. And then the test is very accurate. So they've tested this. It is very accurate. That's not to say there's never going to be a false negative, but the test is very accurate. So, okay, I'm going to try to take one more. I'm sorry, I've got to hop off of here. I see, do we have enough tests? As far as I know, yes. I have been told that we have enough tests. We do not test. I want to reiterate that. The health department does not test for this illness. So these tests are being done at the provider's office or at the hospital. And so to say that the health department has tests, we do not. But when I say we, I mean the county or our providers locally in general. My understanding is that we do. I'm going to do some follow-up after this, just based on some of the comments here. Are there guidelines for traveling in and out of the county right now? People can travel as deemed in those in the stay-at-home order. The overall arching goal of stay-at-home orders and the statewide order is that people stay home as much as possible. Again, we understand there is essential travel and there's things that need to be done to care for children and that type of thing, and those are exempted in those orders, or are laid out as being exempt. I don't know of any county who, I've heard of some places, but our county anyway, we are not like policing the borders or something of that nature. So there's no requirement that you have documentation to travel in the county. And I heard, when I say I heard, I have not heard anything substantial about other counties and how they're doing that. You would have to reach out to those counties, because when I speak on here, I'm only speaking for St. Francis County. So, in St. Francis County, you can travel as allowed in those orders. Okay, last question for seriously this time. I've seen the N95 masks are recommended, but being as though it doesn't cover the eyes like the MSA Advantage. So the question's about PPE. N95s are only recommended for healthcare workers. So that's important to know. The face coverings that the CDC is recommending doesn't even include surgical masks or N95s. Face covering could be a cloth face covering. They really want to conserve surgical masks and N95s for the healthcare providers. Now, a lot of the healthcare providers, though, are also wearing shields. So I know that there's a part in here that talks about not covering the eyes. So doing a face mask that has a shield, or you may have seen the plastic hoods, those types of things are also things that can be worn to protect, the eyes, the mucous membranes of the eyes where those droplets might get into. So I hope that helped answer that question a little bit. But N95s are should be reserved for healthcare providers. Okay, I've got to hop off here, and I've got some calls to hop on and some things to follow up from the live here. We will update the frequently asked questions by tomorrow. That's how we're doing this on our website, to answer some of the questions that either we couldn't get to, or some of the questions that have been repeats. That way people can kind of go back and find those answers. Those are up on our website. And then I just want to reiterate, as I have been doing, it is imperative that people follow the guidance that has been given by the CDC, the Coronavirus Task Force, from the White House, the state level officials, to social distance. This is working across the nation. Again, this is something that, they'll be researching and looking at how it affected trends. But, right now it is doing what has been intended, at least locally, because, our hospital has enough capacity and we're doing well right now. And remember, our hospital doesn't just serve St. Francis County residents, it serves a region of residents. And so it's important for every one of us to really take personal responsibility for, following those recommendations and doing those things that have been laid out by the experts. Appreciate you guys being on. I know that, again, life is different now, and we've all had to make adjustments, but we appreciate your help in that. If you have questions, concerns, please reach out to us via phone, 573-431-1947. You can also contact us directly through our website. Facebook, I know we get a lot of messages on Facebook and we answer those a few times a day, but we don't have someone who's a social media person who is able to attend to that all day. So really the recommended way to contact us is via phone or through our website. We appreciate you. Thank you guys. Bye.